The Alzheimer's Society of Nova Scotia is the leader in helping Nova Scotians help those who are living with dementia. It is one of the key organizations that are advocating both for the person with the condition as well as all of those who are looking after the person with dementia. And I know I'm considered a healthcare professional, and I like the word caregiver, but I also think that they are the most important healthcare provider because we have the training and know what to do. And in many cases, we're paid to do that and to know how to do things correctly. We're given the research and the supports and the equipment. But we're expecting somebody who's the caregiver to somehow intuitively know how to do all of these things, and they can't possibly know. So I'm so grateful that the Alzheimer's Society is committed not just to the person with dementia, but to the family and everyone else who interacts with them. So this video series is designed to try to help give people more confidence. But when you listen to what we've talked about today, there are so many steps that it can be overwhelming, and we don't want it to be that way. There is what we can do in a perfect world, and then there's reality as to what we're facing on a daily basis. So we created these checklists primarily to help people remember some of the key points of what we've talked about, and they're a reference guide for anybody who might want more information. We don't want people caught up on doing everything correctly, because even we as health professionals with years of training don't do it perfectly every time. We simply know what the best practices are, and we try our best to help everybody know what those things are. So we're just going to go over one of the handouts in terms of what the checklist looks like. And these are really just things that we think about as we're doing the task. We're not sitting there with a pen going, yep, did that, yep, did that. So it's something that a new caregiver, you could give them this when they first come to the home. You can go over it once, or you might look at one specific area of the whole travel from bedroom to bathroom and back that you might be having particular difficulty with. So we're just going to talk about this first one, getting somebody from the bed to sitting up. These are the skills that we talked about earlier in the order that we think about them when we come into the home. You want to make sure the environment is safe before you worry about the person. You want to look at the height of all of the furniture to make sure that it's going to be the easiest for the person to get up. You're going to help the person, if they're getting out of bed, move to the side of the bed, roll and get up, and use them to do the most of the work and help them pivot. You're going to make sure that they're holding on to something if they have a rail, preferably not holding on to you, and then you're going to bring them up to the side of the bed, bringing their knees over the side. You're going to make sure that they're pushing and trying to do as much as they can, and you're going to use momentum to try to help them come all the way up. You're going to let them sit on the side of the bed to wait till their heart rate and blood pressure settles, and then you're going to lower the bed until the person's feet are touching the floor. And the reason for that is that it's easier for a caregiver to help someone sit up if the bed is up high, but you want the person's feet on the floor as quickly as possible. So lowering the bed only works if you have an electric bed. That's the only time this applies. And then once they're steady and they know what they're doing, you're going to get them the mobility aid that they need, and then off you go. So these are the steps, keeping in mind that when we train personal care workers in these steps, it's sometimes 6 months to a year training people how to do this. So again, you're not going to look at the checklist and do it once or twice and then feel complete confidence. It's going to come with time. So these are just some of the other checklists. How to help somebody stand up, and it doesn't just have to be for going to the toilet. So this applies all of the time. How to walk someone safely. Where do you stand when you're holding on to them? I'm always standing slightly behind the person on the side that is their weakest. If they're unsteady, I'm going to have a safety belt around them, even though they have their walking aid. I'm going to make sure their path is clear, and I'm going to make sure that I know the distance that they can safely walk, and I'm not going to ask them to go any further than that. The most important thing if you're using a four-wheeled walker is that the person's brakes are on before they stand and as soon as they stop moving. So I say the brakes on a walker are just like the brakes on your car. They're on every minute that you're not moving forward. And sometimes you might have to help the person put the brakes on because they may not remember to do that. Sometimes somebody wants to sit down on a walker, and if they do, I always encourage them to put it up against a wall so that if they sit, it won't move when they go to stand up. They need to make sure that the brakes are on, and they need to be careful when they're turning around. So these are skills that we would practice with someone. Once we're getting somebody close to the bathroom, then there's a whole series of events that have to happen. And the more this is done in the same pattern every time, the more likely the person will understand and anticipate. They may not remember, but as they're going through it, they may help because it's repeated over and over again. And then this is just the safety check in terms of what the person themselves is doing. The previous checklists are what you're doing. So we want to encourage those you're helping to do as much as possible, even if there's some risk to it. We obviously don't want anyone to fall if we can help it, but we do want to encourage the person themselves doing as much as possible when they're doing that. So this is just the contact information for me and for Catherine Ann. And we're both available for anyone who has any questions about the presentation, and we're available through email or phone calls. And this is the contact information for the Alzheimer's Society, and we want to thank the Alzheimer's Society for making this series possible. It is one of the critical steps in creating a dementia strategy for our province, and having the caregiver have the confidence and the comfort in knowing what to do is one of the best things that I've seen happen in my career. And I'm so grateful to the Alzheimer's Society for making this opportunity available. We will want to know if this series was helpful for you. We'll always be open to revising things down the road as we get feedback. So there will be a survey for those who are attending an information session, and we appreciate any feedback that anybody might have. And now we're going to have time for questions for those who are at our lecture. Thank you very much.